For more anatomy videos, please subscribe to my channel Learn Anatomy with Dr. Tanya Hashik. Hello everyone, in this video we will discuss the anatomy of urinary bladder. Urinary bladder is a muscular bag which is located in the anterior pelvic cavity. It stores urine which is produced by the kidney and also it helps in its disposal. Urinary bladder is made up of detrusor muscle or detrusor urinae, and its mass contraction result in the passage of urine. Now we will look into the location, size and shape of bladder. The size, shape and location of bladder, it depends upon the quantity of urine it contains. Although the bladder it is a pelvic organ, it can reach up to umbilicus or above when it is full. Now we will discuss the external features of bladder. An empty bladder, it is tetrahedral in shape and it has got an apex which is directed forwards, a base which is directed backwards, and it has also got a neck which is the most lowest and fixed part of the bladder, and it has got three surfaces, that is the superior surface, the right infralateral surface, and opposite to it there is the left infralateral surface. And it has got four borders, that is the anterior border, the posterior border and also two lateral borders. Now we will discuss the relations of the bladder. So this is the sagittal view of male pelvis and this is the apex of the bladder, and the apex it is connected to the umbilicus by means of medial umbilical ligament, and it is the remnants during the embryonic period and it is also called as the obliterated embryonic urachus. Next is the base of the bladder. In case of males and females, there are some differences. So the upper part of the base is related to the rectovesical pouch in case of males, and it separates the rectum from the bladder, and the lower part it is related to seminal vesicle and also to the vas deferens. In case of the females, the base of the bladder is related to the cervix and also to the vagina. Now we will discuss the neck of the bladder. So neck, it is the most fixed part of the urinary bladder and it lies 3 to 4 cm lower to the pubic symphysis. In case of males, the urinary bladder neck is surrounded by the smooth muscle bundle, whereas in case of females, the neck is related to the pelvic fascia which covers the upper part of the urethra. Now we will discuss the relations of superior surface. In case of males, it is covered completely by the peritoneum. In case of females, the superior surface is covered by peritoneum except at the posterior border which is in direct contact with the cervix, and the peritoneum it reflects to the uterus and forms the utrovesical pouch. Next is the infralateral surface. The infralateral surface is not covered by peritoneum. The two infralateral surfaces are separated by means of anterior border and it is separated from superior surface by means of the lateral border.